when I completed my fellowship training, I actually became critically ill on the last day, and really the tables were turned, and I saw everything from the vantage point of a critically ill patient, whereas before I had really only been oriented to the doctor's view. And really what I saw was that so many of the things that we take for granted that we're doing well, we're actually not doing as well as we could, and a big part of that was communication. The medical treatment was all, amazingly, astoundingly skillful, and I survived things that I don't think were survivable because of our skill. But the casual lack of attending to suffering, the lack of compassion that occurred at times, I saw myself as part of that. And it was those small things that helped me to realize that even when we think we're doing our best, that there's a lot that we could be doing better.
We all consider ourselves to be excellent communicators. We all consider ourselves giving patients and families excellent experiences. But there are skills that we just haven't learned. There are culture change around healthcare that we haven't yet been exposed to. And this class can really help us in an actionable way amidst a pressured day to improve the patient's and family's experience.
The three main components right now of our physician communication strategy are a fundamentals course that's 4 hours, and that's required for all of our new senior staff in their first 6 months of hire, but it's also open to a variety of other physicians. Our shadowing process, which is really elbow support for our providers right there in the setting where they're providing care, either on the inpatient setting or outpatient. And that allows us to be able to check if the fundamentals have transferred into their day-to-day work with patients. And then our Clear Conversations program, which is really a deeper set of training and experiential learning around complex plan of care and how to deliver difficult news. And that workshop actually also involves professional improvisational actors.
One of the hardest aspects of communication for clinicians is recognizing emotion and acknowledging that emotion, even in the face of all of the other competing things going on in any visit. And so for me, that's been one of the most powerful things about this work, is to really focus on the emotions behind these difficult situations and to help clinicians be able to take a pause and just take a moment to acknowledge that emotion.
I get a very limited period of time in the emergency department to size up my patient, and they also get a very limited period of time to size me up and make sure that they know that I value them, that they can trust me, and that I know what I'm doing. And that all comes from really a unwavering commitment to first impression and clear communication with them.
Medicine's very fortunate. We have so many tools at our disposal now, many therapies that weren't available 10 and 20 years ago. To deploy them well, to know what to reach for when, you really have to know your patient and what's important to them so that every treatment aligns with your patient's values.
I think it is hard to be an effective communicator in medicine. We're often communicating about highly emotional topics and highly technical topics. And so I think it is challenging to be an effective communicator. I think that for all clinicians, it takes training and it takes practice.
When I was in med school, we definitely had courses on physician communication, but they're definitely more focused on how to take a history and physical from a patient. We had really minimal training on end-of-life discussions or having these difficult type discussions with patients and family members. I'm new in this process. I'm developing my communication skills. So to start off with a really good organized set of tools that I've learned from that course is really helping me as I move on and try to continue to improve both in my medical knowledge but also in how I communicate with my patients.
The interpersonal skills are, to me, as important as the biomedical and technical skills, if not more so. And so I take great joy in learning these things. I think it really enriches my experience as a doc. It reduces my chance of having burnout because I can walk in and have a good experience even in the midst of a pressured day.
The training opportunities will allow me to round out my skill set and continue to be better. And what I'm very hopeful for is the more successful I am in communicating with patients, the more gratifying it's going to be for me as a physician.
Ideally, the doctor-patient relationship is one that's based on a foundation of trust, compassion, with really a connection that is reciprocal, where caring for someone helps rejuvenate your love of medicine and why you do it, so that there's resilience and empathy that flows both ways.